Hi, this is Dr. Tsay from Ageless MD. We're going to be demonstrating today the highly sought after procedure called the cat eye thread lift, or also it's called the fox eye thread lift, where we basically use PDO barbed threads to lift the corner of the eye in an upward direction, changing that corner of the eye shape. It's very similar to what the women are using their makeup eyeliners for already when they draw that little slight uptick in the corner of their eye, but we're doing it without surgery, using the threads and creating that very exotic effect without surgery using the barbed threads. These results typically last up to a year. We usually reinforce the barbed threads with smooth threads on top of that, which boosts collagen and reinforce the effects of the barbed threads. Now, some of the common reactions or post-care following the thread procedures, we typically prescribe an antibiotic for 5 days for prevention of infection. Swelling, bruising is common, and you can have discomfort in that area because it feels very tight because there is a significant amount of tension and pulling in order to create that effect that can last up to several days, but the bruising and swelling eventually resolves and you have the end result, which is the cat eye, fox eye thread lift. So with the cat eye thread lift procedure, we're going to be changing the eye position, and I've drawn out my vectors, and the vectors basically mean this is the direction that I'm going to pull. So the direction is an upward lateral direction, and it's going to raise the corner of her eye. You see when I pull in this direction, it changes the shape of the eye just a little bit. And with this procedure, you can go as more dramatic or less dramatic if you want, depending on how hard you actually pull. So you can pull as very hard to give an extreme appearance, or you can pull a little bit more on the moderate side so it's not so exaggerated. So we have our young model here with us, and I've done her lips before about 11 months ago. And so you remember getting your lips done, and how did you like it?
I love them. I love how plump they looked and how you left them and they lasted this long already.
Yeah, so 11 months out, and what percent do you think is still remaining from before?
Like about 70%.
So she's holding on to it for a pretty long time. I mean, most people come in between 6 to 9 months, And it depends on your body's metabolism, how quickly the fillers will go away. I mean, some people can last longer than that, and some people with a faster metabolism could go through the product fairly quickly. So she's back here 11 months later, and we're gonna just do like a little bit of an adjustment. We're gonna use the product Juvenim Ultra Plus. It's hydrophilic, it gives a nice plump. And tell me a little bit about what you want me to focus on this time.
Just on the bottom, I want to plump just how you did it. Maybe a little bit fill it on the side, just to even it out. But they look good, so.
Okay, did you want me to do anything on the Cupid's bow, or is that's good enough for now?
I think that's good right now. Just kind of fill it.
Just the edges and then even out the bottom.
Plump, yeah.
Got it.
I love the bottom one plump, so when I smile, it's still there, it doesn't disappear.
Got it, got it. Let me look at your side profile. And so she's got a really nice profile. The lips line up with her nose and chin. So, so just evening out and adding some symmetry and balance is our goal today.